Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Hook. A quick story to get us started. A woman I cared for was discharged from the hospital after a heart procedure. She left with a paper list from the cardiology team, a different list from the hospitalist, and a pharmacy bag with medicines none of her family recognized. 2 days later, she fainted at home because a blood pressure medicine had been doubled by mistake. I still remember her daughter's voice, terrified and angry, saying, "We thought we had everything under control." That moment stuck with me because it's so preventable. Today, I'll give you 3 concrete actions you can use today to reduce that risk. Keep 1 accurate medication list, always verify 3 key facts at each handoff, and bring the actual meds or photos to appointments. These are simple, practical steps you can start using on your next visit. Promise and roadmap. What I mean by medication reconciliation and why it matters. Medication reconciliation is the process of creating the most accurate list possible of all the medicines a patient is taking and using that list to compare against new orders during every care transition. That sounds straightforward, but handoffs fail for predictable reasons. Multiple prescribers using different records, over-the-counter and supplement use that never gets documented, unclear instructions about what to stop or continue, and human errors when names or doses are similar. In the next sections, I'll walk through common failure modes I see at the bedside, give you a short checklist to prepare for discharges and clinic visits, and teach exact scripts and verification questions you can use with clinicians and pharmacists. I'll also explain when to escalate if something feels unsafe. This is practical, not academic. My goal is to leave you with clear next steps. Section 1, What Goes Wrong? Common failure modes and real examples. First, failed or incomplete lists. Patients arrive with dozens of sticky notes, outdated lists, or no list at all. In one case, a patient listed an allergy to penicillin, but not that they were taking a blood thinner prescribed months earlier. The new team ordered a procedure without accounting for that drug. Second, name confusion. 2 medicines with similar names or 2 patients with the same last name in the same clinic can cause a swap. Third, over-the-counter drugs and supplements. Herbal products, ibuprofen, and even topical creams can interact with prescription meds, but often aren't mentioned. Fourth, stopped versus continued orders. Sometimes a discharge summary will say restart home meds without clarifying which ones were intentionally held in the hospital. That creates duplicates or dangerous restarts. Finally, pharmacy transitions. Pharmacies sometimes substitute generics or call prescribers to change doses, and the communication loop breaks. Each of these failures is common and usually preventable with a few consistent actions. I've seen patients readmitted because of these exact patterns. That's why the checklist I'm about to give you matters. Section 2, the patient checklist. A step-by-step, easy-to-follow routine you can use at discharge, clinic visits, and pharmacy fills. Keep this short. 3 immediate actions, 1 daily habit. Action 1, maintain 1 single accurate medication list. Include drug name, generic and brand if you know it, dose, frequency, route, pill, inhaler, injection, reason, and who prescribed it. Use a paper card, a note on your phone, or a printed list. Just keep 1 master copy. Action 2. Bring the medications or clear photos to every handoff. A photo of the pill bottles is often better than memory. Action 3. Use the 3 verification questions at every handoff. Ask, what is this medication? Why is it being started or stopped? And how and when should I take it? When preparing for a discharge, do a quick reconciliation before you leave. Compare your home list to the discharge list line by line and ask staff to explain any differences. If you have multiple specialists, send that single list before the visit or upload it to the clinic portal. For pharmacy fills, confirm that the pharmacy has the correct drug and dose and ask the pharmacist to check for interactions with your full list. These are low-effort but high-impact habits. If you're the caregiver, take the lead on keeping that list updated. Small routines like checking bottles once a week prevent big problems. Section 3. Scripts,
practical tools, and when to escalate. First, exact phrases that work. To a clinician, can we go through my medication list together and confirm which medicines to stop, continue, or change? To a pharmacist, please check these 3 medicines against everything I'm taking and tell me if anything could increase my bleeding risk or cause drowsiness. For the discharge nurse, can you explain any medicines on this discharge list that weren't on my home list and why they were added? These short, structured requests focus the conversation and make it harder for details to slip. Practical tools: use a single printed template with columns for name, dose, frequency, purpose, prescriber, and last updated date. Keep a pill box for daily organization and take a photo of the weekly setup after you fill it. Store copies of discharge summaries and prescriptions in one folder or a secure phone album labeled meds. Now, red flags that mean escalate: new confusion, unexpected bleeding or bruising, fainting, sudden breathlessness, or any new symptom after a medication change. If you suspect an error, pause medication use only when safe. Don't stop critical meds like insulin without talking to a clinician. Instead say, "I'm concerned this dose might be incorrect. Can we pause and double check with the prescriber or the pharmacist now?" If the team won't verify, ask to speak with the pharmacist, the nurse manager, or the patient advocate. Document your concerns in writing and get names and times of conversations. That helps speed resolution and keeps an audit trail. Remember, escalating isn't about making trouble. It's about preventing harm.
Takeaways and action items. 3 things to do right now. 1. Create and maintain one accurate medication list. Update it weekly and bring it to every appointment. 2. Use 3 verification questions at every handoff. What is it? Why am I taking it? And how should I take it? 3. Always bring the meds or photos and involve the pharmacist early. Bonus: if something feels wrong, escalate to the pharmacist, nurse manager, or patient advocate. Document who you spoke to and when. These small steps reduce preventable harm and give you more confidence when care is changing hands. If you're an early career clinician listening, invite patients to show their bottles and make reconciliation a standard part of every intake. It takes minutes, but prevents errors. CTA, if this episode helped, please subscribe for more nurse-led myth-busting and patient advocacy tips. Share this with a caregiver or family member who manages someone else's medicines. These are skills worth teaching. For clinicians and attorneys, if you want deeper tools or a template version of the medication list I mentioned, check the show notes for a downloadable checklist. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.